Ever feel like you need to quickly get up to speed on what's really important in diagnostic imaging accreditation?
Especially with RadSite and how it all ties into, you know, quality and safety.
Yeah, exactly. Like cutting through all the noise and just getting to the essentials.
That's exactly what we're going to do today.
So we've got this RadSite accreditation overview here.
And we're going to really zero in on the key takeaways, their history.
Their expertise, and especially, this whole new remote scanning accreditation program.
That's right.
So it's kind of like your shortcut to understanding not only what RadSite is,
but why their approach to accreditation.
and especially this remote scanning initiative is actually significant for the entire field.
Absolutely.
We're going to be highlighting all those critical milestones.
And the expertise that's driving it.
So RadSite didn't always start out focused on accreditation, right?
Yep, they did not.
It looks like they kind of evolved over time.
They definitely did.
So what were some of those initial steps in their journey?
Well, back in 2005, they were initially focused on credentialing and certification within imaging, so a broader look at professional qualifications. But then came a really key turning point, I think, in 2010, when they transitioned to become an independent accreditation organization.
Oh, wow.
And that move paved the way for their specialized advanced diagnostic imaging, ADI accreditation programs, which launched in 2013 and really concentrated initially on the cornerstones of advanced imaging, so CT and MRI.
So they built this foundation first in professional standards and then moved into accrediting the equipment and facilities. And then it seems like they just kept adapting to new technologies as they emerge.
They did. If we jump to 2021, you see the introduction of accreditation for dental and medical CBCT.
Oh, wow.
So that shows their agility in addressing that evolving landscape of imaging tech.
Right.
And then by 2024, they reached a pretty significant milestone. They had accredited over 2,000 ADI systems and locations.
Wow, that's huge.
Yeah, that kind of growth really indicates, a real need and uptake in the industry.
For sure.
And now, the really noteworthy development, for our discussion, is in spring of 2025, they're launching their remote scanning accreditation program.
Okay.
This latest step just further underscores their commitment to staying at the forefront of how imaging is being delivered.
So 2,000 accredited sites by 2024, that already speaks to this established presence.
It does.
And this move into remote scanning just feels incredibly timely given how much technology is changing healthcare delivery as a whole.
Absolutely.
So who are the people that are actually leading this whole effort?
Right.
Because it sounds like there's a really deep well of experience behind it.
Yeah, RadSite really emphasizes the depth of experience within their leadership team.
Okay.
You've got Gary Carneal, their president and CEO. He's been involved in bringing over 30 healthcare accreditation programs to market in the last 25 years.
Wow, so he's seen it all.
He's seen it all.
Okay, so he's no stranger to this process.
No, he is not.
Who else is contributing their expertise?
You've got Mark Kasner, who chairs the accreditation committee, bringing valuable insight into the process itself. You've got Dr. Mark Hyatt, who serves as the chief medical officer, ensuring a strong clinical perspective. You've got Julie Irons, the ADI accreditation director. Patty Jenkins leads the CBCT accreditation efforts. Dr. Phil Patton, as chief physics officer, is critical for maintaining the technical and safety standards. And Dr. Elliot Siegel chairs the ADI Standards Committee, which is so fundamental for defining those benchmarks for quality in advanced imaging.
Yeah, so it definitely sounds like they've assembled a team with a really wide range of specialized knowledge.
Oh, absolutely.
And it's not just the senior leadership either, right?
No, it's not.
They have over 100 volunteer committee members.
They do.
Serving across 5 different committees.
They do.
You've got the ADI Standards Committee, the Conebeam CT Standards Committee, the Accreditation Committee, and the Remote Scanning Standards Work Group.
Yes.
And the RadSite Advisory Board.
That's right.
So it sounds like these standards and processes are not developed in isolation.
Not at all.
There's a pretty broad community that's shaping them.
Absolutely.
So let's say a facility wants to apply for accreditation. Who actually reviews their application?
So the accreditation review team is designed to provide a very comprehensive and balanced evaluation. You've got administrative reviewers who are managing the procedural aspects. You've got radiologist reviewers who focus on the clinical image quality and interpretation. And you've got physicist reviewers who assess the safety and technical performance of the equipment. So it's a multidisciplinary approach.
Gotcha, makes sense. So all the critical aspects are examined.
Yeah.
Okay, so that multi-layered review process makes sense.
It does.
Now let's really dig in to this new remote scanning accreditation program.
Okay.
You mentioned it launches in spring 2025. What are the key things that it's designed to cover?
This is a really significant step forward, and as you noted, it is imminent.
Right.
And what stands out is the comprehensive nature of this program.
Okay.
It doesn't just address the technology that enables remote scanning.
Mm-hmm.
It examines that entire operational ecosystem.
Wow.
This includes defining the roles and responsibilities of the in-suite staff
Okay.
who are physically, with the patient.
Right.
It covers both MRI and CT modalities.
Okay.
The specifics of the remote scanning operations themselves,
Mm-hmm.
the clinical workflows that support remote scanning,
Right.
and importantly, quality benchmarking
Okay.
to ensure, consistent and high-quality results.
Regardless of location.
Regardless of location.
So they're looking at the entire chain of events.
Exact.
From the patient being prepped for the remote expert reading those images.
Yes.
And everything in between.
Everything in between.
To appreciate the rigor involved, can you talk about the timeline a little bit?
Yeah. The Remote Scanning Standards Work Group was formed in August of 2023.
Okay.
So this was not a quick decision.
Right.
And then those standards were approved by the Standards Committee and the board in August of 2024.
Mm-hmm.
And then they achieved CMS approval in December of 2024.
Wow. So it's a pretty long process.
It is a long process.
Yeah, to get it going.
Yeah, and it really highlights the level of consideration and scrutiny applied to this new program.
Okay, and you pointed out something earlier that was really interesting.
Okay.
This is the only remote scanning accreditation program
That's right.
covering this set of elements. So what makes it so unique?
The key differentiator is that holistic approach.
Okay.
So, other accreditations might touch on certain aspects of remote radiology.
Yeah.
But RadSite's program is specifically engineered to address the unique challenges
Oh.
and requirements of remote scanning operations across, from in-suite staff to remote protocols to quality metrics.
So that's what really sets it apart.
It does.
Okay, so for anyone involved in or even considering remote scanning,
Yes.
this accreditation really seems like it could be a very important benchmark.
It could be.
So stepping back a little bit,
Okay.
what are some of the overarching highlights or benefits of RadSite accreditation in general?
Okay.
Like, what's the core value proposition for a facility?
Well, ultimately, it's about fostering and recognizing best practices
Okay.
within, the diagnostic imaging field.
Okay.
One of the key strengths that RadSite emphasizes is their robust standards committees.
Okay.
And those committees involve a diverse range of stakeholders.
Mm-hmm.
They actively solicit public comment.
Oh, wow.
And they even use beta testing to make sure that the standards are not only rigorous,
Right.
but practical and implementable in real-world settings.
So public comment and beta testing really speak to a commitment to transparency and incorporating feedback
Absolutely.
into the standards.
It does.
Okay, so they're not just coming up with these things in a bubble.
No, they are not.
They're really trying to get feedback from the people who are going to be using it.
Exactly.
Okay, that's great. And then they also have this customized accreditation portal, right,
They do.
to help streamline the process.
It's designed to streamline the entire accreditation process.
Wow.
For facilities, it's an enterprise-level solution
Okay.
that supports everything from answering application questions to uploading required documents.
Okay.
It's cloud-hosted with secure user permissions and an online library of relevant resources.
Wow, that's so convenient.
It is.
So they've even integrated DICOM image upload through Ambra Health, which helps with sharing medical images.
It does. It facilitates that secure sharing and review of those medical images,
Okay.
which is so crucial for quality assessment.
Right, especially in remote scenarios.
Especially in remote scenarios.
And then they even can integrate with existing enterprise solutions
They can.
to preload documents.
Preload documents.
That's great to really reduce the administrative burden
It is.
on the facilities. And of course, security and data backup
Of course.
are built in.
Yes.
So it really sounds like this is designed to make the accreditation process as efficient as possible
As efficient as possible.
for providers.
Yes.
And then what about the actual review of the accreditation application itself?
So as we discussed, the review team is multidisciplinary.
Right.
It's got the administrative radiologist and physicist reviewers.
Mhm.
What's interesting is that during the accreditation committee's review, the applications are blinded
Oh, wow.
to ensure an unbiased evaluation,
Okay.
leading to a decision of, pass, fail, or the need for corrective action.
Okay.
And importantly, they also have a formal appeals process in place.
Gotcha.
If a facility disagrees with the decision.
So the blinded reviews add another layer of objectivity to the whole thing?
They do.
And it sounds like they're not just looking for compliance. They're really focused on continuous improvement.
Yes.
Through feedback.
Yes.
So tell me a little bit more about that.
So they specifically highlight meaningful feedback as a core element of their approach.
Okay.
And they emphasize two-way communication throughout the entire process. And in fact, they state that no imaging supplier achieves accreditation without making at least one helpful change.
Wow.
Based on the feedback they receive.
Okay.
So it's really about ongoing quality improvement and not just a one-time assessment.
So they're in it with them.
They're in it with them.
For the long haul.
For the long haul.
To try to help them.
Exactly.
Right.
It's a collaborative effort to elevate the standards across the board.
Okay, so it's not about just checking boxes.
It's not just about checking boxes.
It's about really learning and refining processes.
That's right.
Okay, so how does RadSite accreditation actually contribute to smoother and more effective workflows within an imaging facility?
Well, they address this by looking at several key operational areas.
Okay.
So from an educational standpoint, the accreditation process covers a wide range of clinical and operational elements. And those feedback mechanisms help facilities, identify and address any gaps in their knowledge or processes.
Okay.
Clinically, it reinforces professional oversight and encourages standardization of protocols and procedures, which leads to greater consistency and reliability from a business perspective. It helps to establish sound governance structures, identify and mitigate potential business risks, and supports the implementation of well-documented workflows, all of which contribute to greater efficiency and operational stability.
So basically like a framework that encourages better organization and standardization.
Exactly.
Okay, and then what about the impact on the quality of care and the performance of imaging services?
Well, in terms of quality, RadSite accreditation promotes transparency through benchmarking against industry standards.
Okay.
So facilities can see how they measure up against their peers. It demonstrates a clear commitment to quality-based operations.
Okay.
It requires the adoption of evidence-based clinical pathways. And it can even enhance a facility's reputation, with regulators and payers.
Okay, so it can actually help their business.
It can help their business.
Okay.
And then regarding performance, the focus on those streamlined workflows, both clinical and business, creates an environment that can foster innovation and relies on measurement of outcomes and continuous performance improvement initiatives.
So it's all about getting better over time.
It's all about getting better.
Okay, so it's not just about validating a certain level of quality.
No.
It's about being a catalyst for ongoing improvement.
Yes.
And efficiency.
Yes.
So someone's listening, they say, wow, this sounds great.
Okay.
Where can they go to learn more?
Well, they offer a variety of resources to help facilities learn more and navigate that accreditation process.
Okay.
The overview document doesn't provide specifics on each, but it does mention webinars, informative blogs, detailed publications, and press releases that would offer more in-depth information on specific programs and requirements. They also provide direct contact information. Their phone number is 440-6007.
Okay.
Their email is info@radsitequality.com. And their website is www.radsitequality.com.
Easy enough.
They encourage, interested parties to reach out for more detailed information.
So they're there to help people through the process.
Absolutely.
Great. So to wrap up our deep dive today, what are some of the most critical takeaways for our listener?
Okay, the key things to remember. First, RadSite has, a substantial and evolving history in the accreditation landscape, demonstrating consistent growth and adaptation to the changing needs of diagnostic imaging. Second, their leadership and the extensive network of volunteer experts across the various committees provides a strong foundation of knowledge and credibility to their accreditation program. And then perhaps most significantly, the upcoming launch of the remote scanning accreditation program in spring of 2025
represents a crucial development offering, as they state, uniquely holistic approach to ensuring quality and safety in this increasingly important field of remote diagnostic imaging.
Exactly. So for you, our listener, understanding RadSite accreditation, especially this new remote scanning program, really gives you a valuable framework for assessing quality and best practices in advanced diagnostic imaging.
Absolutely. And this leads to a really important consideration for you as remote technologies become more integrated into healthcare delivery. How might accreditation programs like RadSite shape the very definition of quality and access in a more interconnected healthcare ecosystem?
That's a great point.
Think about the implications not only for the providers who are adopting these remote modalities, but also, and perhaps even more importantly, for the patients who are receiving care. In this evolving landscape, it's a dynamic field.
It really is.
And understanding the quality assurance mechanisms is going to be paramount. Absolutely. Thanks so much for joining us on this deep dive into RadSite.
It was my pleasure.
And we'll catch you next time.
Sounds good. Bye.